Today, I would like to explain what are the main features of a FotoFinder device for a clinic, for a doctor, and for the patient. The reason why this type of technology is worldwide growing and creating an added value for hospitals, dermatology clinics, oncology clinics, okay? In general, the very first point is when a clinic decides to document data, document information. The reason why we have these devices is because skin cancer requires monitoring of patients. This has been proved in several studies. When a patient is part of the risk group, it means parents had melanoma, the patient had melanoma, this patient must be in a routine of documentation. We standardized this routine with a method that was developed by Argenziano from Napoli, Malvey from University of Barcelona, and it's called the two-step method. I would like to demonstrate this to you what it means. Two-step means you first take clinical pictures of the patient, and basically on the clinical picture you mark lesions and you basically take microscopic pictures. So you work in two steps. First step is clinical, second step is microscopic. The idea is to have a complete documentation of the patient with lowest risk of missing changes or new lesions on the body surface. In fact, this is a very good example of a patient of high risk. So we have done clinical photography, we have done dermoscopy, and now the patient comes back in the follow-up, so we are able to compare the pictures. And in fact, by comparing, we can realize if there are things that new details on the skin, new lesions, changes, and relevant points which help us to better diagnose. Apart from the standardized photography, what is very interesting is the artificial intelligence algorithms integrated in FotoFinder. So you have the body scan tool, which allows you to basically see perfectly the new lesions and changes. This is a tool that is quite popular in worldwide because it helps you to better see what is highlighted, what is basically relevant for the eye. You see a lot of white circles, you see yellow circles, and you see red circles. White circles are basically lesions that didn't change throughout the time. Yellow circles means there is a change, maybe in size. Let's have a look at this lesion, in fact, and we realize that this lesion was basically changed, it grew. It was there at this size and then it grew in size. Some changes might be relevant, some changes might be not relevant, okay? This is something that the doctor decides at the end in his diagnosis. We just highlight whatever is new or changed. In case of this lesion, you realize that this just wasn't there before, okay? So we didn't have this lesion before. If you click on the body scan twice, you remove all the white circles and you just basically see the relevant stuff. And in fact, when we look at this area, we see that this lesion wasn't there before. And based on studies, 70 to 80% of all melanoma that is found in Europe or in Central Europe in the studies are new lesions. So for us, actually, novel lesions are extremely important when we hunt melanoma. The same we can do basically here, and we scan the patient with a so-called magnifier. Okay, this is a tool that FotoFinder developed in order to basically scan the body and find the relevant things easier. Again, coming back to the methodology, it is about global photography, microscopic photography, and a very well-documented file of patient which allows you to also forward it, let's say, to the oncologist in case you want to do that. Once this is done, you are able to go one step ahead and in fact analyze also the lesions in a microscopic way. So we have a look at some cases of lesions, for example this one. The picture of lesion is taken and now you can basically analyze this single lesion because you are interested to know what could this be. When analyzing lesions, we believe it's important that your eye is trained to follow checklists. For example, in here we have the 3-point checklist. When we talk about asymmetry, we talk about colors, we talk about borders. We have Argenziano's 7-point checklist, we have the ABCD rule. Well, they count for sure for more advanced types of skin cancer. But in general, we give also a very good library of cases of moles that might have similar characteristics in order to help you to do your diagnosis better. In here you see information about asymmetry, about colors, which again help you to make the diagnosis yourself. Or you basically go and you search the help of artificial intelligence. In this case, when we click on it, it says it's not a diagnosis, but it's a quite well second opinion. And you will get a score of malignancy. The score of malignancy of artificial intelligence is shown basically in percentage and in 3 fields. In the yellow field, you mostly find lesions that have a low possibility of being malignant. In the gray area, you find lesions that look strange, so you might definitely follow them up. And in the red area, you find lesions that have a high possibility of being malignant. That means, in this case, we have 0.8, 80%. That means 80% that this lesion is among these ones. These are all melanoma and malignant lesions. So the artificial intelligence says 80% that this lesion is malignant. Doesn't know what it is, but it says 80% malignant. And it is correct in this case because it was a melanoma case which we got from collaborators worldwide. So you are able to print basically also nice reports. The reports help you to write your comments, to provide this to the patient or forward the patient to the oncologist. In general, for documentation, we recommend 6-month or 12-month routine follow-ups, which again is all registered in the machine. The machine also can remind you to make this documentation in a very coherent way. Now, when we look at general cases, we see that in the follow-up, a change of lesion can be also recognized. This can be also relevant. So, in many cases, the melanoma might be a new lesion, which you remove, or a lesion that basically is in evolution. The patient already part of a risk group. As you see, the lesion was basically here on the back of the patient, and within a period of 4 months, the lesion changed. If we analyze this lesion, we realize that there is a clear asymmetry visible. And at the end of the day, we have in area 15% more. We have the borders changed, the entire symmetry of the lesion changed. And we can very well show this also in mole analyzer by showing exactly where this lesion got basically modified within this month. Obviously, you have now also some features which might conclude to malignancy. And in the artificial intelligence scoring, in this case, it tells us that in the first part, the first image, we were basically high possibility of this lesion being benign. Afterwards, the lesion changed, and now we are in the gray area. This is typical for in situ melanoma, okay? So they do not have clear features of melanoma, clear features of malignant lesions, but still they look strange. and our software gives quite well good score on this. In fact, with FotoFinder, you are able to do documentation, to do analysis, and to do a proper way of follow-up of patients. The camera itself has an extremely good quality of focus on vessels, focus on blood vessels, on vascularization, and this is can be very helpful also for other issues when it comes to inflammatory diseases, when it comes to trichoscopy. This camera can be very interesting. I would show it to you maybe on a live case. As you see, the FotoFinder in this case comes with a camera and a lens. The lens allows you to basically do quite well and magnified pictures of the skin.
Okay.
Nice.
Good. It looks like suicide. Right?
Mm-hmm.
Good. So when it comes to the Medicam, you have the possibility of basically screening the patient, and in fact, thanks to the video dermoscope modus, you are able to really have the perfect focus on the skin. So you can see the vessels, you can see the pores, and you can basically have a very nice view on the surface of the lesion. And you can basically zoom in and zoom out. This helps you to better highlight the features that are interesting. In general, the Medicam is the main tool to work with when it comes to dermoscopy with FotoFinder. It is simple in fact because we follow also with this device the simple method of two-step method. That means clinical picture and microscopic picture. So you can use this camera for clinical photography, very popular also when it comes to standardized way of clinical photography. So you could take pictures, close-up pictures of the area of your interest. So you can basically take a picture of this area, or in this case, you can take the picture of this area where I was now. And the good thing is when the patient comes back, you can follow this up easily, you see? So you can divide the window and then just do a follow-up of the same area and do this. A lot of people use this also for acne treatments, for static treatments. So the advantage of it is that you can, in fact, use the light to highlight, in fact, wrinkles when you do filler treatments. So you can basically use the close-up LED for that. Or if it is a patient, let's say with acne or any type of brown spot, you would turn off the light, and then you have the possibility to better see the brown spots. You see, as in this case. So in any case, you have the possibility of lots of documentation, easy documentation. You can also do nails. This is very popular too. So at the end of the day, you have the possibility to do standardized way of photography with the distance holder. When you finish with that, we can easily connect the lens and then start doing your microscopic photography. In this case, we could basically mark this lesion. We could mark, let's say, this one, and we can just basically do microscopic imaging. What I like about it is the logic. It shows you exactly where are you, which part of the body you are. Then it gives you a very good view on basically with clinical zoom that you don't miss the lesion, and then you are able to basically take this picture, centralize the lesion, and save it. When it comes to dermoscopy of nail, you are able to basically take it and also highlight the capillars. I mean, a good thing about FotoFinder is that you are able to basically see the shape of the capillars. And this allows you to also use it for rheumatology and the diseases of blood circulation. I like it because in that sense you could also do a video in case of if you want to save a sequence, not just a picture. So you change the modus, you basically enlarge as you like it, and then you start maybe a video to see much better the changes of this. So you are able to take a video, to zoom in and discover basically relevant things. So you see, this is a video that now I took. So you can basically take a sequence and zoom in and zoom out to discover basically relevant things. So in my opinion, the interesting part is there when you see in the gallery. You can save videos, and at the same time you can save pictures. Good. In general, the patients usually return every 6 months, 12 months, some of them every 3 months, based on the type of biology, type of risk that you see. This is in the field of dermoscopy. When we go one step ahead, we could use the same program also for alopecia. That means a patient comes to the clinic and is suffering hair loss. In most cases, the patient has a subjective opinion. That means the patient feels that every day is losing hair. Sometimes it's quite normal, but it's annoying the patient. In order to talk about facts, you have to take photography, clinical photography and microscopic photography. Our recommendation is to follow a protocol standardized. And the protocol that we follow is called trichoscopy, developed by Lidia Rudnicka in Warsaw University in Poland. So we take a microscopic image of the scalp at level of 20 magnification, and then we increase the magnification. What happens? At a very high level of magnification, you are able to perfectly visualize the problem of alopecia. In this case, androgenetic alopecia. I would say almost half of all the patients who come to the clinic have androgenetic alopecia. And if you want to treat them, it's good to communicate with them with pictures, because they rather believe in your treatment and they come back and stay in the process. So when it comes to financiality of such a machine, it's extremely important that you give an added value to the patient and allow the patient to understand the treatment process, and the patient will become very, let's say, will have a confidence in your clinic and in your treatment. In this case, we see this is a healthy hair, so we call it a terminal hair. The hair shaft is definitely above 60 micron. This hair, if you don't do anything, turns to this. That means it becomes thinner, vellus. And then it becomes even thinner until it is lost and you have an empty follicle. So this is a very nice circle which you can show here to a patient, and the patient understands the purpose of the treatment. The patient doesn't have the expectation that suddenly he turns with an afro, so the patient rather wants to just not lose more hair. And here you can start with mesotherapy, with minoxidil, with PRP, whatever treatment you do, and follow it up with a FotoFinder. What is very interesting is that, in fact, you are able also to use FotoFinder for analysis. So at the end of the day, with a FotoFinder, you are able to go and measure the hair thickness, as you see here. So you can exactly see if a hair is thin, if a hair is thick, if a hair is basically healthy or already damaged. Okay. In this case, we can see that this patient has some good hair and also some very thin hair, and this will definitely have an effect on the treatment. You can count the follicular units, as you see. You can basically calculate the density of hair and the density of the follicular unit, and you can count also the yellow dots. You see, these are the yellow dots which you can count in here. And at the end, you have a very nice statistic with pie charts of vellus and terminal hair, and you can exactly show what is the average hair shaft thickness. In this case, we have an average hair shaft thickness of 41 micron. You have lots of vellus hair. You have basically 56% of the hair are terminal. That means they are good. Half-half. This is already quite advanced alopecia, androgenetic one. And at this stage, you can still save the patient. What is interesting again, that you can here print a report, provide it to the patient, and send the patient home with a standardized report, and also type in your diagnosis and your treatment proposal. And the patient will start the process, come back in 2 months and 3 months, and you do it again. And this is the added value. This is how you charge the patient. This is how you make this an added value for both, for the doctor, for the clinic, and for the patient. At the end of the day, when you use the same process with a more detailed analysis, you would provide the information to our lab. Our laboratory is using artificial intelligence and human eye to give you even better statistics. This is highly recommended when you do PRP or mesotherapy treatments, because in this case we would analyze the whole scalp and give you a lot more statistics. And in here you have also a conclusion, which is a diagnosis coming from a doctor, and you have a perfect solution to start your own hair clinic. In my opinion, no matter how you see it, from taking the pictures, from the protocol, from the microscopic view, up to analysis and report, FotoFinder offers you a complete solution for hair as well as for skin. This is actually the message of this video. The new software allows you to work in a way more precise than before, and allows you to do less errors. For example, if you mark a lesion, and let's say in the baseline of the patient, automatically when the patient comes back for the follow-up photography, the device puts a clone marker in the second picture. And this is very good because you cannot miss the lesion, you cannot get confused. You would not mark the same lesion twice. So when you see the original marker has always this color of the flash, and the clone marker has the circle. In my opinion, it is very good, very important that this is like this, because in all the continuous follow-ups, you will find this lesion as number 20, and you will not basically mark it twice and be documented twice. This is a great feature which happened into the new FotoFinder. In fact, if you go on and mark this lesion out of mistake twice, you have also the possibility to merge it. That means you can just click on the both and then merge these markers. And at the end, you will have one of them. So you have many possibilities of making less errors and work with higher precision. So this is definitely a tool that helps a lot. Yeah, that's it. I think in dermoscopy and trichoscopy there is no more to say. For aesthetics, we will now basically issue a new software, and I think by January I would do a webinar online and send you the video of the webinar.